Hello, everybody. Hope you're all doing well. My name is Damani Johnson, and the case I'm going to present today is called A Family Divided. So, a quick overview of the story. A middle-aged man is in the hospital after having a severe stroke. It has caused him to be in and out of consciousness, unable to eat food of any matter, and unable to form sentences. Presented with the information, his wife and their 4 children are tasked with planning for his future. It's explained that his recovery would be a severe disability for the rest of his life, and the patient has no preconceived plans in case his health would deteriorate. So to start off, the first questions ask, the judgment of fertility should be a conclusion of a communications process, not a beginning. How will you propose beginning the communication? And right under that, I just went ahead and answered that first one. I just sit here. I would honestly try and be as empathetic as possible. I agree that the judgment should be concluding in this case. I think it's important that sometimes when you have a crazy case like this, that if you're presenting information to someone about their loved one, it's important to kind of not only be empathetic, but to lead with what's going on, the severity of the case, and then ending with your better judgment. Continuing on, the other parts of the question ask, who should be present, what information should be shared, what alternatives are on the table, and then lastly, what is your goal in participating in the discussion? My answer for the first one, I just said his wife and adult children should be present, especially if they're his next of kin legally. And of course, a lot of times when you're in the hospital and something happens and you're deemed unable to make a decision for yourself, the next of kin, would be present. In this case, he has his wife, and then they have, of course, adult children who should be in the room as well. And then secondly, as far as the information with the case, I said it's important to know all information regarding his condition. It'll help the family understand the severity of his condition. And I also forgot to say that it also allows for the family to know, try to make the best decision as possible, with knowing of his condition. Number 3 said, as far as the alternatives of the case, there aren't many alternatives in this case, due to the patient's condition. So he had the option to give them the feeding tube, or the other option was to pretty much not place him on any secondary medical machines, whether it's a feeding tube, a respirator, even any medicines that he wasn't used to taking. So that's also something to think about here as well. And then lastly, number 4, my goal as far as participating in the discussion will honestly just be as level-headed as possible, as well as attempting to choose the best method of care for the patient. I have a tendency to be level-headed in very serious situations, so that would be my overall goal for this case. So next we have the second set of questions. So it says the family is divided over whether their husband and father should be placed on the feeding tube. Consider and discuss the following statements. The effectiveness of the feeding tube is a clinical matter. The benefits of the feeding tube for the patient depend on the patient's wishes and quality of life, which the patient or the patient's surrogate and family must determine. The burdens the treatment imposes are a consideration for both parties. And my answer, I feel like answered all of those parts in one, or two answers. I said the feeding tube usually is a very helpful tool in nursing a patient back to health. However, in his case, it could possibly make his condition worse. He has aspiration, which could worsen his condition, and that's something I didn't touch on. But aspiration is when you have food or liquid or anything. When you swallow it, it doesn't go directly to your digestive system. It goes into the airways. It goes into your lungs. And of course, in this case, that won't be good at all, which is why the feeding tube is such a taboo subject in this matter. As well as stated in the case, his cerebral cortex was badly damaged, which explained to the staff that him being able to swallow wouldn't be a possibility. And then of course, having the feeding tube and having aspiration, it just it gets worse every turn. And then the concluding questions, I have 3 of those. It asks, role play the discussion, express your assumptions and loyalties, and listen attentively to the other speakers. And then number 2 says, evaluate the role playing experience. Did it affect your view of the case? If yes, how will you advise the family and the healthcare providers? If not, what is to be done now? Then lastly, how would this case have been different if the attending physician had been the one asking for a consultation? And that relates to the family asking for an ethics consultation. So in my concluding statements, the first one I said, I have been in this role before. And it isn't the best feeling. However, you try and do what's best for your loved one. In that case, you must put your personal feelings on the shelf. It's important that the person gets the best options and alternatives as well. And then secondly, I said it did affect my view of the case, considering I have been in this position before. It's very hard to be in a place where it feels like you're playing God with someone's life. I would advise the family to think heavily about his well-being and how their decision could affect him overall. Considering he can have the feeding tube could possibly make his condition worse, as well as him not being able to eat. And then if he was to recover, it'd be a severe disability for the rest of his life, which can include, a nursing home or 24-hour care. And it's just like, it's kind of sad to see someone go from, a normal everyday person to being bedridden. And then lastly, if the physician was the one asking for the consultation, it would have been different, because in that case, I believe, the physician could have been the one making the decision. And overall, considering that that person is, has the medical background, has the education, they will probably be on the other side of not giving him the feeding tube. And then also maybe they would have wanted to make the right decision, just as much as the family. I think in this case, the family, of course, is thinking, well, the wife and one of their children is thinking more empathetically, versus the other side of their children, who are thinking more textbook. If we give him the feeding tube, this is what's going to happen. He's already, bad, so how worse could it get? This is a pretty interesting case, considering I've experienced something like this before. But that's why I wanted to cover this, and I hope everybody has a great rest of the semester, and thank you.